Depending on the kind of health care you need, there can be waiting lists in Ontario for specialists and surgeries.
Some patients are choosing to head south of the border for quicker access to some health care, but there is no guarantee any of those costs will be covered. Here's Pat Foran in Consumer Alert. Pat.
Thanks, Natalie and Michelle. A man says he was operated on in Ontario 9 different times and his health care problem was not resolved. He says he felt he had no choice but to go to the U.S. for an operation. It cost $600,000 and he feels OHIP should pay for it.
I had the 3 months of life left. If I didn't do this, I wouldn't be able to talking to you today.
DePietro Gregorio of Maple is 78 years old and has a history of Crohn's disease. In 2019, he had a bowel obstruction and emergency surgery to deal with it. After the operation, he says he was told the surgery wasn't necessary.
When they finished, they said that we didn't really have to do this. Ooh.
Gregorio says he was left with a colostomy bag but was told it could be reversed. He says what followed over the next 4 years were 8 more operations to correct the procedure, but in the end, issues remained. He ended up with 2 bags and was in severe pain. He was told nothing more could be done.
It was really bad. I was looking for a way to end my life.
With nowhere to turn in Ontario, he traveled to Ohio to the Cleveland Clinic. There he was told an operation could improve his life, but the cost would be $600,000. After the 11-hour operation, he says he finally felt relief.
They can do a better job.
And do you have a colostomy bag now?
No, nothing.
Gregorio says he's not impressed with Ontario's healthcare system. When a U.S. doctor fixed in 1 operation, what Ontario doctors couldn't in 9 surgeries.
Why it took us 9 attempts to fix the same problem that they fixed it with 1.
Gregorio says he's paid healthcare taxes all his life and believes Ontario's Ministry of Health should cover his $600,000 hospital bill. But he was told it has been determined the medical treatment you received out of country does not meet the criteria to be considered an emergency. As a result, payment for health services has been denied. Gregorio feels he had no choice but to go to the U.S. and believes at least a portion of the bill should be paid.
It's not fair to say we can't touch you anymore, we can't pay you anything. That's definitely not fair.
And if an Ontario doctor recommends out-of-country care, you may be able to have U.S. hospital bills covered, but you must have written approval from the Ministry of Health in advance before receiving the services. On your side, I'm Pat Foran.
If you have a consumer story idea, email us at alert@ctv.ca.